An electrocardiogram is mainly used to measure the heart rate and electrical activity. Physicians use this painless process to quickly evaluate how a patient's heart is functioning and find signs of potential heart-related condition. It is necessary to keep your ECG motion clean to maintain a healthy environment and keep measurement accurate. Here we give a quick guide to take good care of your equipment. First, cleaning. The general guidelines for cleaning ECG lead is including avoiding using ammonia products. Because ammonia products will make the leads hard and inflexible. Dust off dirt and apply a cleaner to a soft tar to clean the ECG cable and the lead wire. Place the disinfectant solution onto a soft rag and wipe the cable. Don't let the solution touch metal parts and the soft connector end, because this can cause corrosion. Wipe off the products with a dry rag and air dry them at least 30 minutes. Daily visual checks. First, check all the cables are not bent, knotted or damaged. Replace the damaged electrical plug, sockets or cables. Make sure the knobs, switches and the indicator are tightly fitted.